years ago, my dad was diagnosed with stage 4 colon cancer, and ever since then, I've been fascinated to learn more about it. Today, you guys will understand more information about colon cancer. Do any of you guys know somebody or did know somebody that had colon cancer? Okay, moving on. For those of you that don't know what colon cancer is a cancer of the large intestine, which is the colon, and it's in the lower part of your abdominal section. Some of the risks are being older than 50. If you eat a lot of red processed meats, you want to aim for eating a lot of fiber in your diet because that helps with the knot. Having a family of history of colon cancer, and if you yourself have a history of having breast cancer. And then also having rectal polyps, which I have a video later and that'll go kind of into more detail about that. Some symptoms are if you have blood in your stool, if it's difficult to go to the bathroom, like if you're seeing like different signs when you go to the bathroom, like more diarrhea, constipation, things like that. Narrow stools, and if you have sudden weight loss without reasoning. Some exams that you can do is a colonoscopy, which is pretty much they put something on a stick like a camera and they put it up your butt and they go in there and they see things that are happening in there. Another one, definitely a blood test to see if anything's wrong with your stool. Some more is a fecto-optical blood test, which is a FOBT. And it directs small amounts of blood in the stool and it may suggest colon cancer or may not. And then just function test and things like that. Here's the colon cancer and what it was. This is the circles are the colon cancer. This is the descending colon cancer, transverse colon cancer, descending colon. And then that's the bowl, which now I have the video.
Descending colon, and the sigmoid colon. The cause of cancer is an uncontrolled multiplication of cells lining the colon. Before a true cancer develops, it usually begins as a non-cancerous growth called a polyp. Certain people can have multiple polyps in their colon, which are inherited genetically. Over a period of several years, a polyp has the potential to become cancerous. A cancerous polyp grows rapidly in size, eventually breaking through the wall of the colon and spreading through the tiny channels called lymph vessels. The cancer can also spread through blood vessels to other parts of the body. Symptoms of colon cancer are blood in the stools, a change in bowel habits, resulting in either more constipation or diarrhea than normal, abdominal pain, unintended weight loss. Treatment varies depending on the stage of the disease. Some patients will need surgery to remove the diseased segment of the bowel, followed by radiotherapy or chemotherapy.
There's mostly 5 stages of colon cancer. Stage 0 is a very early cancer in the innermost layer of the intestine. Stage 1 is cancer in the inner layer of the colon. Stage 2 is cancer and it's spread through the muscle walls of your colon. And stage 3 has colon cancer and it is spread to the lymph nodes. And stage 5 is colon cancer and it's spread to other organs or intestines in the body. There's different kind of treatments for colon cancer depending on what stage you have. A lot is surgery, and what they do first, they'll put you through chemotherapy or radiation depending on what stage, and then you go through that for about maybe 6 months, and then you go to have surgery, and if needed you go back on chemotherapy or radiation. There's also the option of burning the cancer and freezing the cancer, so that's a pretty cool way of getting rid of it. Some of the preventions is getting a screening before you're 50, or if someone in your family has colon cancer when you're 20. changing your diet and lifestyle, eating more high fiber foods, not healthy, not junky food like that. Some studies reported that aspirin, ibuprofen, medicine like that may actually help reduce the risk of colon cancer. I know when my dad passed away, 2 of his friends that are in the family actually went to the doctors, told them what happened, and they got checked, and thankfully they did because they had polyps in their colon, so that's weird. There's 5 myths mostly about colon cancer. One, that it's a men's disease. It's not. It's actually common in women too, just as common as it is in men. Colon cancer cannot be prevented. It definitely can be prevented, like most cancers. Just go get your test done and they can tell you what to do there. African Americans are not at risk for colorectal cancer. They're just as risk as any other race. Age doesn't matter when it comes to getting colorectal cancer. About 90% of people that have colon cancer is over the age of 50, so it is kind of a factor. And it's better to not get tested for colorectal cancer because it's deadly anyway. Almost every single case of colon cancer is preventable. 90% is testable. You can get it checked and whatnot. So always get checking if you think that you need it. And then